This is a heat map of the United States, and as of August the 14th, and 84% of the counties in the country are at a high transmission rate, and 10% are substantial. So 95% of the counties have a high transmission rate throughout the country. This this graph here shows the recent. Let me get my laser pointer here. This graph here shows the recent surge in cases. And when we spoke last week, the incremental increase in the 7-day moving average from the prior week was 33%. This time, increase of 18.4%. But I don't think that gives the impression that things are slowing down. It's just when you're using a week's worth of data, there are more abrupt peaks and troughs in the data, or changes in the data. So this is something that has to be trended out over a longer period of time to make that meaningful. This is the Washington State case rate curve, and the numbers have gone up since this was reported on Monday. I pulled this off the internet on Sunday. This is reported as of August the 5th. So there's a 12-day lag on this slide here. The case rates did peak on August the 11th. The case rate was 400. And in mid-December, the case rate statewide was 500 to 525 cases per 100,000 over 14 days. So the peak, the line is somewhere around here right now. This is a heat map by county showing the percent increase in cases, and the darker the county, the higher the increase in cases. And these dots here show percent increase in hospitalizations. And this next slide will kind of summarize that. 7 counties, and Walla Walla is included in that, have had less than 100% increase. And we've talked about that over the past several weeks, that the shape of our wave was flattened compared to other parts of the state. 12 counties have case rates in between 100 and case rate increases of 100 to 299%. Some 10 counties have had increases of 300 to 599%. 6 counties have increases more than 600%, and then a couple of counties have a lot lower rate. We've been looking at some of the counties around us, and these numbers are a lot higher than this slide. I just didn't have time to update it, but Benton County has surpassed the peak that they experienced back in the winter, and I believe Franklin County has crested above 1,000. And this slide is as of August the 5th, so everything is bigger, higher. Likewise, Walla Walla continues to creep up a little bit, although as of August the 5th compared to August 15, our case rate was unchanged. Again, you need a longer time horizon to really see if that's meaningful, but there was a suggestion that maybe even though our case rates were high, but they kind of plateaued. Mondays, our case rate from yesterday was 44, which is kind of high, but sometimes over the weekend, some of the cases don't get reported in a timely manner, and then Mondays tend to have a higher number of cases. This was the county ranking in case rate as of, I want to say this was as of the 12th, and we were 5th in the state. And we mentioned yesterday that Lewis County is probably going to take us over. I looked again this morning, and we have now dropped to 1, 2, 3, 4, 5, 6, 7, 8, 9, 10th place. So a lot of other counties have taken over with case rate as of August 15, 2 days ago. We continue to test more per capita than any other county in the state, and we test about twice as much per capita as even King County. As far as forecasting, this is from the CDC. They do forecast that case rates will continue to rise. Our cases in Washington State tend to have this shape of a curve with regards to demographics. We're seeing that 73% of our cases are in those less than 50 years of age, so this accounts for the bulk of our cases right here. That's by state, and our county numbers mirror that. We see the same kind of shape. Ours are broken down in smaller groups, but the shape is the same. So that's how cases are being diagnosed. But as far as hospitalizations, it kind of has an inverted look. As people get older, they have a high risk for getting hospitalized, except for the older age group. This is possibly due to the fact that this group has a higher penetration of vaccine in that group. And 71% of our hospitalizations are over the age of 50. So most of our cases are less than 50, but our hospitalizations, most of those are over the age of 50. And then deaths by age group. As people age, it's higher risk for death, and 95% of our deaths are over the age of 50. The CDC predicts that deaths will continue to rise across the country. As far as hospital occupancy, the state average is 86%, 85.7, and Walla Walla is in the South Central region, which includes Benton Franklin, Walla Walla, Kittitas, and Yakima counties, I believe, and we mirror the hospital occupancy. And this is all comers, not just COVID. Of the COVID admissions statewide, about 10% of the hospitalizations statewide are COVID cases. With regards to ICU occupancy, the statewide average is 85%. Our goal is to keep it less than 80%. That was part of the roadmap to recovery metrics. So we've gone beyond that goal. And of the ICU admits, about 20% are COVID patients. Looking at vaccination rates by demographics, we have this pattern where as people get older, they tend to get vaccinated more. We see the same pattern in Walla Walla, although our rates are lower, somewhere between 8 and 10% lower than the state average. The CDC did recently make a recommendation for people to get a third dose. They don't use the word booster, and these are for immunocompromised people. And they do recommend that you use the same vaccine that was given with the first 2 shots. And if the mRNA vaccine brand that they got originally is not available, that you can cross over, but we want to try to keep it within the same brand. And they do not recommend an additional J&J dose. This is a slide that just talks about the different conditions, but basically immunocompromised people can get the third dose, and we're asking people to talk to their providers and see if they are eligible, and if they are, they can get their vaccination at Southgate. It's an honor system. We're hoping people will check with their physician, but we just can't discern or police that. So we did have the vaccine blitz last week, and we got a whopping 255 doses. That includes primary doses and some booster doses. So we talked before that we think we need about 13,750 people to get vaccinated just to get to the 70% mark. This doesn't account for our upcoming pediatric groups, which that will open up probably October, November. But our goal until then is to just keep pushing towards getting that 70% of eligible people vaccinated. So in the community, we are trying to expand the Southgate availability because of decreasing demand. The Southgate clinic was originally 3 days a week, and it dropped down to 1 day a week. Last week we had it open 3 days a week, and I'm trying to work with some of our state partners and contracted teams to get Southgate open daily, Monday through Friday, something like 8 to 5, and we're still ironing out those details, but I think that would be helpful for our community. Even though we are testing more per capita than any other county, we have heard concerns from community members that getting in for testing can be cumbersome and difficult. So we're trying to get Monday through Friday, 8 to 5 availability for testing as well through Southgate. And then we have our continued mobile efforts for homebound and pop-up clinics. And I'm working on developing what I'm preliminarily calling jabs on wheels. My wife does Meals on Wheels, and I get a sense that there are people out there who maybe want to get vaccinated, but due to privacy issues, they don't want to go out in public domain. So we're going to try to, if we can get staffing, consider trying to deliver vaccine to them, even though they're not homebound. There have been pushes from CDC and the governor for indoor masking, a recommendation is the terminology. There currently is no mandate. The governor, last week there was news that the governor was supposed to announce a possible mandate for indoor masking yesterday. It didn't happen. I don't believe, I haven't heard, so potentially today the governor may make an announcement on that. We will see.